Good morning, Dr. Todd. I'm happy to see you this morning. And as the medical director for Conduit Health Partners, I just wanted to spend some time with you this morning talking a little bit about the quality of what we do within Conduit, your role in helping drive that quality and making sure that we are serving patients and our clients to the best of our ability. One aspect of that is our nurse triage program is URAC certified. You sit and you are a part of that process, which is a very rigorous process to ensure that the quality of our services, while triage is the service that is URAC accredited, we apply those principles across our entire business. And you've spent time shadowing our staff. I would just love to hear your perspective on the quality and how we measure that quality within Conduit Health Partners.
Well, good morning, Cheryl, and it's great spending time with you. And, as you offered up that introduction and your first comment, immediately what comes to mind is professionalism. And I'm not going to talk about Schmidt-Thompson protocols that we lean on and our nurses leverage. What I'm going to talk about is really the time I spent with those nurses and kind of being a fly in the wall as they triaged. And I'm thinking back to the last time I did this a couple of weeks ago. And I think it was Brian, the nurse, was speaking with a mature woman who had multiple chronic conditions. And I don't think I could have, as a provider, could have offered up the level of service that he offered up to this client, this patient. And at the end of the call, I think it was 8 to 10 minutes, talk about allaying fears. This patient was scared when it started. At the end, a completely different tenor and conversation at the end. And it was clear that Brian offered up not only great clinical advice, but this reassurance to her that all was going to be well, that he was going to get her back into her primary care doc as quickly as he could. And turns out that was like next day, which is unheard of today in primary care settings. So that was awesome for that patient. But professionalism is what I think of when I think of our nurses. And you could talk about the training that we do at Conduit Health Partners. You can talk about how we record some of the calls and sit down with our nurses to work through difficult spots during a triage visit. But of course, it wouldn't be the same without the leadership team within Conduit, who are basically all nurses, who understand what the struggle of nurses in today's environment and the level of its mentoring to these our triage nurses that occurs.
Great, thank you. So as you think about triage and you think about transfer center and moving on into that area of our work as well, what do you think about the quality and the benefit to our clients from even the nurses who are, because we use registered nurses not only in triage, but we use them as well in the transfer center. What value do you think that offers?
Well, standardization is important. The Schmidt-Thompson protocol drives that in the triage. But the standardization around evidence-based practices. So evidence-based from a triage perspective bleeds over, if you will, into our transfer center capability. And so it's all about evidence-based. And that gives a level of comfort to an individual provider, to a client who has many different providers, to a insurance company that is serving the enrollees in their benefits plan program. So it's a level of comfort that the client feels, knowing that evidence-based principles are being, just weaved in to into the services that we offer.